care, actually we call it medical care, not health care. When it comes to medical care, I am pro-choice. I believe that patients should have choice and that decisions should be made by patients with the consultation of their doctors, not by the government. So that's the premise. I know that right up front. Now, what I'm going to talk about really 5 things. Talk about number one, some of you heard what they've had to say as doctors. There are things that they didn't tell you. They didn't really tell you how bad it really is. I can say some of this because they won't say it. They're too humble, I think, to really tell you how bad it is. I'm going to talk about number one, the impact on doctors. Number two, what that means to you as a patient. Number three, I'm going to talk a little bit about what's going on in Washington, D.C., and particularly with organized medicine and how that's kind of distorting the message that's coming out to the public. And we'll talk a little bit about some of the things that are out there that are good. But number five, most importantly, action steps for you, because I think that's the reason that you're here. It's one thing to hear about the problem, but to sit there and feel powerless is just miserable, isn't it? Without some solutions. And the Congress has already shown us that we have to really, slap them upside the head to get their attention. So I'm going to talk about how to slap them upside the head. First of all, let's talk about the impact on doctors. Now, we talk about government medicine. That's what they're trying to do. It's government medicine. We already have government medicine, as you just heard. We have Medicare, we have Medicaid, we have the VA system. So let's talk about what we have already and say, let's see the example. We already know Medicare is way over budget, that it's going bankrupt. So we know that the money is the issue, but let's talk about some other things in Medicare. Doctors at the rate of, did I mention there's math in my presentation? I'm sorry. So this is the note-taking part. Our survey by AAPS matches other national surveys. About 1/3 of physicians in the country will no longer accept new Medicare patients. You're nodding heads. You're having trouble getting into paid to doctor. You've had this with your family. Okay, further, 40% of doctors restrict the services that they provide to their existing Medicare patients. Some of the more complex procedures, some of the more risky things for them, the more time-consuming. You just heard Dr. Thacker talk about the time issue, if it takes up too much time. And as an aside, I'll mention that, yes, the reimbursement rate is very low. An office visit, anybody know what doctors get for office visits? What's your copay if you have insurance? $20, $25? $30. Most doctors would make more if they got that $20 copay than what they're paid by Medicare for that office visit. In some areas, a brief office visit is as low as $12. You didn't know that, did you? Okay. So, we have doctors who are not taking new Medicare patients. They're restricting services to the Medicare patients. And I just mentioned money, but if you listen to the AMA says it's all about money. And the reason for this is money. But that's not the case. By far, an overwhelming number of doctors say the reason is
government interference.
The hassle factor. Hassles or threats from the government carriers and fear of retaliation, prosecution, and actions against them. Way down the list at number 5 is money. I was on a radio show with a doctor, or at a congressional briefing or radio show, I get lost now. And I said to her, she's like Dr. Thacker, she takes no government contracts, no insurance contracts. I said, if we doubled your money right now, would that be worth it to you to start taking those contracts? She said, no. No way. I couldn't practice medicine the way I want to practice. So the AMA is telling you that it's all about money. Now, here's the question. With what you heard Dr. Stark outline, is that hassle factor likely to go up or down if we have increased government involvement? Okay. for you as a patient, you are going to have trouble finding a doctor. Our survey also shows that 2/3 of the doctors say that they are now considering retiring earlier than they ever thought possible. They'd just as soon get out. You take a doctor, like these doctors sitting here, Dr. Schlitt is a surgeon at this age, is in his comfortable years here, but he is old enough to have tremendous experience. He's young enough to still be at his peak. That's the kind of doctor who's going to say, screw it. I can go do something else. I've got one more left in me before I throw in the towel. I'll go do something else.
He can become a congressman.
Well, it's funny because they don't tend to listen to the doctors up in Congress either. That's an unfortunate thing. In March, when President Obama threw the big healthcare summit, I kept calling it the White House disco dance and prom, because it was like they only invited the popular kids. And two of the people who didn't get involved were invited were two members of AAPS who happened to be physician members of Congress. One is Dr. Tom Coburn in the Senate, and one is Dr. Tom Price in the House. And their invitations were just lost in the mail. So if you're the White House and you're inviting people to talk about healthcare reform, you'd think you'd ask the doctors, wouldn't you? So the doctors in Congress don't get no respect. Okay, so we're talking about things that the doctors won't tell you. They would rather treat some Medicare, Medicaid patients for free. That's really important. What does that tell you? They would rather treat them for free than to mess with the government regulatory hoops. That's some of what doctors are experiencing. Doctors, the practice of medicine is regulated by more pages of federal regulations than there are in the tax code. Yep.
How about the legal problems?
Well, and we haven't even talked about liability and legal issues. Well, I'll talk about that and the things that need to be done. So that's how that is for doctors. Doctors are required. Let me give you some examples. Doctors, if the patient comes in and is non-English speaking and you don't happen to speak Farsi or Hmong Cambodia, the doctors are required by federal law to provide a translator for the patient for that office visit. And that translator is to be paid by the doctor at his own expense. And that means that translator for that Medicare patient visit is going to make more than the doctor does. So what I want you to remember, when we're hearing President Obama tell us that doctors would rather take out tonsils than treat sore throats because they are so greedy, and that they would rather amputate your leg than treat your chronic diabetes, I want you to remember what doctors are doing to take care of you and how much they really are sacrificing. I want to tell you about a doctor I know in Texas. Her name, I'm going to do her accent. Her name is Dr. Jules, Dr. Juliet Madrigal. And she's this little tiny thing. She's double board certified in internal medicine and pediatrics, but she has chosen to have a little family practice. I'll do the accent again in a minute. She's chosen to do this a little family practice. She has no insurance contracts and no Medicare. Her patients pay her directly, a patient-doctor direct practice. Now what this means is that she can charge $35 to $55 for office visits to her patients. She gives, here's where I'll do the accent. She gives discounts for teachers and preachers. And if you wear spurs to your visit, you get $5 off.